Hello and good afternoon, everyone. Welcome to today's webinar, COVID-19, a 10-point action plan for economic developers. Before we get started, I would like to go over a few items so you know how to participate in today's event. You have joined the webinar using your computer speaker system by default. Through the high capacity of this webinar event, computer audio will be used in today's session rather than a phone dial-in option. You will have an opportunity to submit text questions to today's presenters by typing them into the questions pane in your control panel. You may send in your questions at any time, and we will address them during the Q&A session. I would now like to introduce our moderator, Tracy McDaniel, President of TIP Strategies and immediate past chair of the IEDC Board of Directors. Welcome, Tracy.
Thank you so much. Welcome, welcome, welcome everyone to the third webinar in the IEDC series on how economic developers and their communities are addressing the COVID-19 crisis. It is our hope to be hosting these free webinars each Monday afternoon with the intent to share resources, tools, best practices, and the latest updates. Today's attendance is another record breaker for IEDC. We have over 1,610 attendees. This is so exciting for us. And I want to thank each of you for joining. Today, we are honored to welcome Richard Florida and Stephen Pettigo as presenters to discuss their 10-point action plan for getting urban economies back and running after COVID-19. We want to thank Richard and Stephen for responding to IEDC's call to weigh in with their thoughts by first writing an article with this title, which is featured on IEDC's restoreyoureconomy.org. Richard, you and Stephen have developed a 10-point plan based on detailed tracking of the current pandemic and historical accounts of past pandemics. The conversations with city leaders, healthcare professionals, and economic developers across the country. Both Rich and Stephen are no strangers to IEDC. Richard Florida is a university professor at the University of Toronto's Rodman School of Management and School of Cities, and a distinguished visiting fellow at NYU Sachs Institute of Real Estate. His books include The Rise of the Creative Class and The New Urban Crisis. Stephen Pettigo is a professor of practice at the LBJ School of Public Affairs at the University of Texas at Austin and the director of the LBJ Urban Lab. We are so excited to have you both with us this afternoon. And before we get started, I'd like to let the audience know that you can engage with us by typing your questions into the questions pane on your GoToWebinars dashboard, and representatives from IEDC will be standing by to answer them. When Rich and Stephen come to the end of the presentation, I will ask them a few questions, and we will then take questions from the audience. Rich will start the presentation, so now I'd like to turn it over to you.
Thank you, Tracy. And thank you, Jeff, and all the team at IEDC. The first email I got when we knew this was a pandemic and a crisis was from Jeff, saying, Rich, what do you have to think about this, and would you write something? And Jeff's email was really the prompt for the piece we wrote that Tracy mentioned, and then much other of our thinking and writing. Boy, our relationship goes back a long way. I'll be hopefully we'll be up and running by then, and hopefully joining everyone at the leadership meeting next January. But, you know, something that I wrote to Jeff as soon as this happened, and it's something I can't get out of my mind, is in September of 2001, September, I think it was 10th, I was scheduled to speak at the IEDC conference in Philadelphia. And I remember sending Jeff a note saying, I don't think so, and canceling my flight. And then we learned what had truly happened. And I came to speak, I think it was in an Oakland conference that was one of the high points of my entire life, addressing the crowd and just seeing the enthusiasm of economic developers. And who would have ever imagined that some 20 years later we'd be going through this? As a as a father, and I had kids late, a 2 and a 4-year-old, I can tell you, and I'm sure you've all experienced it, I've never had anxiety like this. For many days, I couldn't think or write. It was a blur. But I think working with you, working with the IEDC team, working with Stephen, who's been a saint, and putting this material together has really helped and been therapeutic for me. So with that, let's get into it. So let's start with the big picture. And as Tracy said, we've really been able to look at the history of past pandemics. Of course, the 1918 Spanish flu pandemic stands out. I've come to learn from talking to my family that my grandparents' generation, who suffered through that pandemic, lost many people and children in the extended family. I was born, believe this or not, I was born in the middle of the 1957 pandemic, and my parents never told me about it. I had no idea there was a pandemic in 1957. I can only imagine what my mom and dad were going through. We looked at past pandemics. We've studied this pandemic extensively. And talked with many, many city leaders. I was just on the phone with city leaders in Toronto and our city manager, many economic developers, some of you, and healthcare professionals. And I'll tell you 2 things that have helped me really think about this. One, talking to medical professionals about what it will take for them to reopen their dental practice or orthodontic practice or pediatrics practice. And 2, just thinking about myself, and this is what I'd encourage all of you to do. Think about yourself when you'll feel comfortable going back out to a restaurant or to a bar, going to the airport, going to a ball game, sending your kids back to school, my kids to preschool, your kids to elementary or secondary school, sending them back to their college dorm. And I think when you think that way very personally, you begin to get the sense of the scope and what we have to work through. And I think as economic developers, we're very fortunate in a way, because our medical professionals and healthcare professionals are on the front lines in this first phase of mobilization. Now, many of us are being called upon to provide financial assistance to small business, the arts and culture, and many other segments of our community. But we have the ability now to help plan ahead for subsequent stages. So the big takeaways from our research, and then we'll go through the deck and take your questions. Our cities will survive. They will grow. No pandemic, and even before we had modern medicine, even before we had antivirals and antibiotics, even before we had modern healthcare, if you look back at the cholera epidemic in London, or even 1918 when workers were packed into factories for the war mobilization effort, living in crowded tenements with rudimentary healthcare, our city survived. New York City, between 1910 and 1930, added more than 1 million people. But we can learn from the past. If our great cities will survive, I think, and Stephen and I believe, our communities will be reshaped. Certain aspects of our communities leave us more vulnerable. Certain aspects of our communities leave us more protected. There will be push and pull factors. Some factors will pull us further out to the suburbs, into rural areas, into smaller towns. Some factors will push us more closely together. And depending on how long this lasts, those factors will weigh against one another. And then we'll share with you our 10 points about how we believe that economic developers can help prepare communities to reopen and recover. As I said, we've had worse pandemics before. In 1918, in London, the Great Plagues in Europe. And you know what? As someone who studied cities and urbanism for now 40 years, and I feel sad to say this, it never registered to me. I had no idea that pandemics occurred. I had no memory of 1957. I had no memory of 1918. The force of urbanization, of growth of cities and great city regions, small towns and big cities, has always been the stronger force. The ability of people to cluster together, to form community, to create great industries, to build startups, to develop. But, you know, it's very interesting. We now have an argument in a popular conversation about 2 things. On the one hand, many people are saying, you know, that density has been a big factor in the propagation of this, that really what has caused this is that dense places will get hammered. And part of that is true, but we've gone into some of these factors. But it's clear to us that these big superstar cities and tech hubs will recover. That, in fact, we may see, especially if there are real restrictions on travel, real restrictions on air travel for the medium run. Some of the tendencies towards geographic inequality and winner-take-all urbanism may be accentuated. However, I think as the commercial office market is hit, the co-working spaces are hit, certainly the hotel industry is hit, there may be opportunities to convert some of these assets to housing, more affordable housing, and to address some of the problems I've called the new urban crisis. Smaller communities, second and third tier metro areas, not just the giant metros, ones that can embrace remote work, smaller suburban communities, rural areas. We've already seen the flight and the issues that it's caused, the backlash that it's caused, as people from urban areas flee to second home destinations in rural communities. But you have to act proactively and strategically. That part of this COVID crisis will reinforce some of the divisions that have already been happening in our society. And I think we've got to be careful about these and think about them in our work. I have a piece coming at City Lab, hopefully this week, early this week, about the class divide in our workforce. About 30% of us, probably everyone on this call, works in a professional job, but it's true of management, it's true of tech work, it's true of financial work, where we can work remotely and safely and have stuff delivered to us. 30 million Americans, maybe as many as 40 million Americans, are true heroes, are in the frontline service work. They're emergency care providers, they're EMTs, they're nurses' aides, they're physicians' assistants, as well as doctors and nurses themselves. They're grocery clerks, delivery people, warehouse workers that are exposed to this virus because they work closely to one another and they work closely with the public. Not only they're exposed in their work, they're exposed in their commutes because often they're exposed in transit commutes or bus commutes. And they're exposed because they live in denser communities and oftentimes because they don't have a lot of money in multi-generational households. It's not just density that's a factor. And it's really important to understand this. One of my colleagues who's an urban planner said, he was the planner for Vancouver, Brent Tadarian, said it's not density, it's crowding. You know, you can think of rich people density or rich place density, where people have a big apartment with amenities, a deck outside or a balcony, and they can have stuff delivered, and then poor people or poor place density, where people have none of that and have to commute long hours to frontline work. And then, of course, it's already accentuating the red and blue divide. As much as we hope the crisis will pull us together, we can already see a divide that's happening, at least to some degree, along red state, blue city lines. Now, I find this very interesting, and I wrote a piece for City Lab on it. I've already mentioned it, but let me go back and just let me harden it a little for you. People say that density makes places vulnerable, and it's true. The virus hit large, dense places hard. It hit New York. It's hitting New York, a city. I was born in Newark. It's hitting New York. It's hitting Detroit, where my wife's entire family lives, and all of my kids' cousins are. Hitting New Orleans hard. It's also hit early at some of the big, dense cities of Asia. But it's also hit at other kind of places. It's hit at places linked through the industrial supply chains, the linkages between Wuhan and China, Detroit and its supply infrastructure, parts of northern Italy, famous industrial districts. In fact, created a whole scientific literature on industrial districts. And of course, these jet-set resort places like the Colorado Rockies and the Alps, where travelers and tourists propagated the virus. But density and size are only one of several factors that make places vulnerable or make them less vulnerable. We've also heard a lot that lockdowns are key, and they are. There's no doubt that lockdowns and social distancing not only have an effect, they're having an effect. The numbers are beginning to turn in some communities in America because we've distanced. And we've not only seen that in the COVID case and death numbers, we've seen that in the digital temperature tracking from folks like Kinza. But there are other factors. And when you think about San Francisco and how people say, well, San Francisco's made a heroic effort. Look how much better managed they are than New York. Step back for a minute. There are certain things that are different between San Francisco and New York, San Francisco and Detroit and New Orleans. It's not just density or lockdown. The point is other factors make some places more exposed and vulnerable and some places less so. One is age. Northern Italy got hit hard because so many of its people are old, and the virus unfortunately hits harder at elder people. Class, income, education, occupation. Here's one for you. Guess what metro in the country has the highest percentage of workers that can work remotely and the lowest percentage of its workforce in frontline service work? San Jose, in the heart of the Silicon Valley. Other metros that score high there? San Francisco, Washington, D.C., those famous tech hubs. In contrast to places like Miami or Las Vegas or Tampa, whose workforces are just composed of more frontline service workers who don't have the luxury or the income to avoid the virus as much as others. New York, by the way, is closer in many of these respects. You think of it as a finance center, but a large city with 5 boroughs with lots of people actually looks more like Miami and Detroit in New Orleans in some of these respects than it does like San Francisco. Health and fitness, more affluent places have less obesity, lower rates of smoking, less pre-existing conditions. Childlessness, here's an area that some people have bemoaned. They've said that certain cities are childless. They've been uber gentrified. We can all have our opinions on that. But the fact of the matter is, if you look at the metros that have the fewest children, and children's are vectors, they're San Francisco and Seattle and Washington, D.C. Other places, because of poverty, because of ethnic mix, because of large numbers of new immigrants, like Detroit, like New York, many other cities, have much larger degrees of multi-generational families. Religiosity. Some places have much higher levels of people who care deeply about religious worship, who may be Christian or Catholic, Muslim or Jewish. And then social capital. The brilliant demographer Lyman Stone tweeted the other day, you look at the theories of social capital, something so important to how our communities are bound together and how they function as a whole. You look at the theories of social capital that singled out Northern Italy. Northern Italy is the benchmark community of a high degree of social capital. Robert Putnam wrote his books about this before Bowling Alone. He argued that we may tragically find that places that have high degrees of social capital, lots of bonding, lots of religiosity, lots of multi-generational families with grandma and grandpa and children all living together, that they were the ones that were most vulnerable to this virus. So what to keep in mind is that there are characteristics of our towns and communities, in addition to density and lockdown, that we have to be aware of and thinking through. I've already mentioned this, but it's something Stephen and I have been thinking a lot about. Even though this will end up, our cities will come through this, New York will recover, London will recover, Toronto will recover, and our big cities and all cities will come through. And while there's very little evidence that past pandemics have altered the course of urbanization in a macro sense, call this macro geography to use a big fancy word, the microgeography of our communities will change. The way in which people are distributed between cities and urban cores, suburbs and exurbs and rural areas will certainly change. There are certain things that will pull us away from urban centers. Look at remote work. You've already seen this big shift if you look at Google Trends or LinkedIn Trends or whatever. People are saying, I want to work remotely. And I think as more of us work remotely, and as there's a cost saving involved because it requires fewer hard assets in office, some of this remote work is going to stick. And there's going to be a demand for remote work. I've been doing a lot of work in Tulsa with the Kaiser Foundation, and Tulsa has made through Tulsa Remote work a priority to attract people. And what's interesting about it is it's not only the $10,000 stipend, it's the ability to provide affordable housing, to build a community of other remote workers. There might be an opportunity to work with companies, the Amazons, the Googles, the Microsofts of the world, to say, if your people are scared of being in big cities, we in our communities can take some remote workers And so there may be opportunities for communities of all sizes, but especially for smaller metros and suburban and outlying and rural areas to benefit from this trend for remote work. I think about 10% of Americans do remote work now, but in some rural communities, about 40% of the workforce does remote work. And from an economic development perspective, remote work makes your own labor market far less dependent on local conditions. There'll be a desire for private amenities. People are going to want their own backyard, their own little play area for the kids. They're going to be nervous because if they're in a city that those amenities have been closed. And I think we're likely to see an increase in what we've seen as rural gentrification, that people are going to head to the hills. But there are push factors that will push back some people back towards cities. Clusters like high tech, finance, media, and entertainment require proximity not only for their work, but if you're a young person and you want to make your name in that career, you've got to get into a personal network. Depending on how long our air travel is restricted, if those VCs and others can't hop between hubs, if you can't super commute from Miami to New York, you're going to have to be in the hub. I think one area that's going to see a surge in value, and we need to prepare for this, is bikeable and walkable areas close to incumbent industries. I think that people are going to be scared of transit and trains, and if they're going to be in a bigger area, they're going to want to be in a place where they can walk or bike to work. And the other thing we've got to prepare with our transit and transport providers, I think we're going to see a return of car commuting and from suburban areas and rural areas as people are afraid of transit and trains. That could really increase congestion, especially in metros like New York or Chicago or Toronto. How do we prepare and plan? Well, these pandemics occur in waves. We're in the first wave now. This is a chart of 1918. It started in the spring, but as I mentioned, in the late spring. So hopefully this wave will be bigger proportionally now, and we'll get a smaller second and third wave. But look, it continues in a big second wave in the fall, and there's actually a third wave before this thing is the heck over in maybe 12 months. Now, look, we have better medicine now. I hate to call it a bright side, but one of the things in New York getting hit, you have the greatest hospitals, the ability to create surge capability, the greatest scientists, the people developing antiviral therapies. You know, Dr. Fauci says we have to learn from the virus. The virus has to teach us. In New York, sadly and tragically, it's the place that can learn from the virus. They will develop better therapeutic regimens. We will get a vaccine. Bill Gates is already funding those factories. Look, hopefully we get over this in 6 months, but as economic developers, I think we have to plan. Maybe 12 months, maybe 18 months, maybe 24 months. We need readiness. Think about this like disaster relief and recovery. We're in the relief mode now of mobilization. We have to prepare for subsequent waves. And here are the 4 dimensions to think about. We'll come to these as we go through point by point our 10-point plan. How do we use health screenings and temperature checks like they're doing in Singapore and China to make sure our assets are secure and safe? How do we equip our frontline providers, but not just our frontline providers? How do we equip our assets and institutions from airports to arenas and convention centers with the personal protective equipment they need? How do we implement design for social distancing now? We already see the DIY versions of this in our grocery stores and our communities. And how do we think about personalized service provision, particularly for vulnerable small and medium-sized businesses, those Main Street businesses, and arts and cultural organizations that could be really walloped as this thing progresses? So maybe the best way for you all to think about this, and this is what Stephen and I have been really thinking about, is as a 3-phase recovery plan. We're somewhat important in phase 1, all-out mobilization. This is the phase of lockdowns and social distancing. But what matters here is medical mobilization, healthcare surge capability, and of course, economic mobilization through stimulus, mainly from the federal government. And we can help there by helping our states and localities and our organizations figure out what's the best way to help our transit providers, our state and local governments provide aid, small businesses. But that's not where we really make the difference. As we're mobilizing on the healthcare and economic front, we need to be thinking 2 steps ahead. Phase 2, And this is where I think we need a big effort, and this is where our work is doing. How do we prepare across the board, from our big assets to our small businesses to our creative sector, to reopen safely and securely? We're not going to hit a reset button and pop back to normal. Maybe it's 3 months, more likely 6 months. What if it's 12 months or longer? How do we go through that reopening period so that we're safe and secure and can get as much as our economy? People are saying we can get 75%. What if we can get 80 or 85%? What if we can shorten it? The more we can do, the better to reopen safely. And then finally, I think where we really add asset is how do we prepare for recovery, disaster relief, and then there's recovery. How do we best position our economies, our clusters, our industries, our businesses, our talent, our places for long-run recovery? That's the way economic developers can add value and think about this strategically. So here's our 10-point plan. Point one, sorry, we jumped ahead a little. Let's get looking at our leading industries and clusters. Let's form some working groups and task force, SWAT teams, to see who's got the pain and who is gaining. Some clusters are growing. Some parts of transport, warehousing, logistics and delivery, grocery are growing. Some others are getting hurt bad. Let's begin to think about our clusters. We've been so successful as economic developers in doing this. Let's think about how to develop the growth ones, to mitigate the losses on the declining ones, and to really move assets in between. Point two. Anchor institutions, our EDs and MEDs, which have been so critical to our economic development efforts. Now, obviously, they're on the front lines. Our medical providers, our hospitals, our educational institutions, some of them are being transitioned into temporary housing for first care providers, some into hospitals. But look, any of you who have a college-age child, are you going to feel comfortable sending them back to now, classes can be done remotely. We can shrink class sizes. Instead of teaching one section of 150, I can teach 5 sections of 50. You're going to send your kid back into that packed dorm, into that packed dining hall? We need to be planning now. If we're going to reopen them, we need to be planning now to get those dormitories retrofitted for social distancing, to make sure kids are safe and secure, to plan for the dining hall and schedule it so that 200 kids and 300 kids aren't going in there all at once, to make sure there's safe areas and medically isolated areas, temperature checks if a kid gets sick. And we need to engage our anchors proactively in local purchasing and hiring and in long-run economic recovery assets. So we need to engage our anchors now to prepare, to mobilize, to reopen and recover. Probably the only asset that's a bigger one to our communities than our EDs and MEDs are our airports. Now, not everybody has an airport, but if you have a domestic airport or you're a global hub, this is critical. It may be the single most important economic driver. I've heard in Canada people say Pearson Airport in Toronto is the nation's most important economic asset. Not Toronto's, the nation. If that is only partially true, how do we get these darn things open? When will you feel comfortable getting on a plane again? When will you feel comfortable going to an airport again? Just think about it that way. We're going to have to, this is going to make what we did in 9/11, it's going to be so much bigger. It's not just going to be, our toiletries in a plastic bag and a TSA screen. In China, where they're reopening, in Singapore, there's a temperature check. They make you write down where you've been. We're going to have to social distance those lines and queues. We're going to have to make sure the baggage areas are not a free-for-all. The waiting areas are going to have to be socially distanced. Maybe we're going to have to work with the airline. Maybe those airlines that spend so much money with fashion designers to get PPE, personal uniforms that are beautiful. We don't want to be going into an airport and everybody's looking like a hazmat suit and the crew has a DIY rag mask on their face and the stewardess, is covered in plastic. We can develop now proactively using local designers, clothing manufacturers, all of this industrial capacity to provide PPE that doesn't look like a hazmat suit. And to get that into our airlines and airports and get our airports prepared over the next summertime so that we can open them. So I can come and join you in January at the next meeting. All of this stuff has to be done now, and we can't be caught with our pants down. Same thing with our large-scale civic assets. That, look, so many of you, so many of us, so many of our communities have put precious community dollars into our stadiums, our arenas, our performing arts venues. Let's get on this. Economic developers, destination marketers, sports authorities, we've got to prepare these things. And it may mean, again, designed for social distancing. Maybe certain seats are kept open. Maybe there's a limit on the crowd. But we've got to get working together to figure out if we want to use these assets, how we can best prepare them for this period of anywhere from 6 months to 2 years of reopening until we get to full-blown recovery. We're just waiting on slide 5. I know there's been a couple of times that it's been a little bit of a holdup. Yep, this happened to me before. Sorry, everybody. We'll go back. Just be patient. There we go. Infrastructure. As I mentioned, people may be scared of transit. They may be scared of transport, and not just subways, buses and trains, folks. I'm really worried about some of the great spaces of America, some of your communities, transit-linked suburbs with those wonderful Main Street corridors, rural places that people were going to, like the Hudson, New York. There's so many of these places on the eastern seaboard or Colorado or California where you could take a train in. If people are scared of using a train or transit or a bus line, these places are going to be vulnerable. So let's start thinking now about how we redesign those bus stops, those transit stops, those subway stops, those train stations, so that people feel comfortable. Let's make sure the transit personnel has the PPE. Let's make sure the waiting rooms are designed for physical distancing. Let's make sure we get the passenger counts right. In China, they are using apps for people to sign up to take trains and transit. Form those task forces, create those working groups, open space. One of, I think, the things that we're doing wrong now, and I understand why we're doing it because we got to send a message, is taping off our parks and open spaces. And I see this in community after community. If people can get outside, it's good, as long as they socially distance. Well, let's get ready. Let's paint circles on the ground. Let's have police, instead of fining people, or our park people, go and say, no, spread out, folks, spread out with your children. Because if they're not going to be in the park, they're going to take that inside where it's more dangerous. Let's get on fixing our streets. Look, one of the things I find is that when people don't distance, it's because the sidewalk isn't wide enough, or the bike lane is insufficient, or somebody parked in a delivery truck parked in the damn bike lane. Let's make sure we get that right. And that's painting lines and circles. Let's make sure on busy streets where people are recreating, let's pedestrianize them. And some of that will go away, and some of that may have to stay. But let's think a lot about transport and vehicular mobility. And where we need to partner with micro-mobility providers like bike and scooter shares, let's do that too. Get ready for more remote work. I've already talked about that. We don't need to go over it, but let's get on remote work and see how many of our people can do it. In some metros, it's as much as 40% of the workforce can do it. And for other communities, I mentioned Tulsa, but other communities, suburbs, rural areas, may be able to position themselves to compete better for these remote workers. This is the stuff that I think is really critical. Imagine now, people are saying anywhere up to half to 3/4 of our small businesses, those mom and pop shops, the small restaurants, the hardware stores, even the small fitness groups, the small gyms and cycling studios and training groups, half to 3/4 of them are not going to survive. So of course we got to get them the SBA assistance they need. But it's not just SBA assistance they need. They have no clue. My friends who own restaurants, who are who look at my barber, the hair salon, the nail salon people, the folks, the trainers, they have no clue how to reopen safely. It's not just going to pop back to work. We need to get them technical assistance, small business technical assistance, to really make sure, and really our medical and dental providers can be such a godsend here. They are thinking so hard about how to redo their waiting room. Maybe they don't have a waiting room. In a small business, maybe you reposition your tables. Maybe you close down the bar. Maybe it's drinks on demand. Maybe for some of this stuff, it's personalized service provision. Instead of having your restaurant open to the public, you bring in groups of 20 or 30 trusted friends. You socially distance. You get a menu in advance. You're careful. Maybe for movie theaters. When my girls this Thanksgiving, when we went back to Detroit, we rented a little theater for them to see Frozen 2 and invited just family and friends. And it wasn't that expensive. But your restaurants and bars aren't thinking about this. You can help them provide technical assistance on the things they can do to reopen safely. And the same goes for the creative economy. Can you imagine walking down a street in your small town, your rural area, your big city, where Jane Jacobs used to talk about the sidewalk ballet, of people frequenting retail shops, Main Street shops, local bars and restaurants, hearing live music. Think about, live music, visiting art galleries, seeing arts and culture, having art walks. You go down your city street, your community street, your suburban street, and there's nothing. It's all shut down. And not just that, your mall is closed down. In a suburban, mall is shut down because people are scared to death to go there. We've got to get these arts and cultural organizations. They're even in worse shape. At least small business can get a darn loan. Arts and cultural organizations, many of these folks work on donations, hand them out. They can't have their gala. They can't have their fundraiser. How do we provide them with financial assistance in the short run? But how do we provide them with technical assistance? I've already mentioned. How do we make sure they know about social distancing? How do they know that they can provide personalized concerts and performances? Talking to a couple of communities, I was saying, let's get an events calendar up, because nobody's going to go see a big concert. They're not going to go see Taylor Swift or another big show, or the Rolling Stones, whatever you prefer. They're not going to go to a big Coachella. But all of your communities have local bands and local artists, and they can put on personalized performances, and not maybe in your house, maybe in a venue, maybe on a city block. But people are going to want arts and culture, and they're going to have a budget to get together, but they're not going to be able to go to those big things. So this is an opportunity for localized, individualized arts and culture. If you're thinking about it now and planning for it now and creating that events calendar, mobilizing forces, you can help the arts and cultural community and give your community options as it reopens. We have to protect those frontline service workers. Look, we know we've paid them poorly. We know they need health care benefits, and we know they need better PPE. They're telling us this. They're threatening to strike. They're threatening to walk off the job. Our Instacart workers, the Amazon workers, the UPS workers, the FedEx workers, the emergency workers, the healthcare providers, these are our heroes. These are our heroes. It took us a while to realize that our working class won us a World War II, and we rewarded them with higher wages and better occupational safety, so they weren't at risk in the factories. Yeah, we can all increase our tips to 20% and do our share, but we can help them make the wages they need and give them the PPE. And it, like I said, it doesn't need to look like hazmat gear, or you're coming up with your scarf tied around your neck. These are big budget places. We can get these people PPE that is non-obtrusive, that looks like a uniform, and that protects them, and our communities can demand it. We can get together with our local designers, our local clothing manufacturers. We can harness that energy to provide PPE that doesn't scare the bejesus out of kids in our community. And we can also mobilize our workforce for this shift. But protecting our front, it's not just about paying people more. because we think they deserve more. This is about protecting our communities. We need to pay people more and give them good jobs and protect them to protect all of us. And the same thing is about our final point, point 10. We need to protect our last advantage communities. We've already seen the maps of New York. We've seen the maps of New Orleans. We've seen the maps of Detroit. Maybe this virus came in through affluent jet setters, through travelers for work. Maybe it came in at our high-income communities and our downtowns. But as I said at the outset, the most vulnerable parts of our communities have been poor and disadvantaged communities, where people are working on the front lines, where they're living in multi-generational households, where they don't have the ability to stay at home, where they're packed and crowded upon one another. They don't have the health care. They have pre-existing conditions. Those communities are vulnerable and make all of us vulnerable. They're not just places the virus propagates, the virus spreads. We already know, just one example, that as the virus is spread through nursing homes, it spread because people had to work multiple jobs. These frontline or healthcare providers had to work multiple gig jobs to make ends meet. We have to protect our frontline providers and our least advantaged communities, and not only because it's a moral thing to do and an ethical thing to do, because not protecting them leaves all of us, our communities and our families, vulnerable. I think that's about it from us. And now Stephen and I would love to take hear your comments, hear your questions, and engage in a discussion about what we can all do to better prepare and ready ourselves for the long road ahead.
Thank you so much, Rich. That was very informative. But, I feel like I need to step back and take a breath after that. Many of us on this call are worried about how we get out of this. I think about my health, the health of family, loved ones. Will I have a job when this is over? And will my skills still be relevant after this pandemic? Now, some of us have discovered the fact that, I don't want to be a remote worker. The isolation is killing me. So homeschooling is not for the faint of heart. And I heard a 2-year-old and 4-year-old, I got 24, 25 years old. They're all around the house. So how do we get through this?
Well, first of all, I think realizing how needed our skills are, and that's what's helped me, realizing that I had a set of skills that may not be as necessary as a frontline healthcare provider or a delivery worker now, the heroes, but are really necessary for recovery, and just saying the heck with it. I'm going to dump everything else I was doing and I'm going to go all in. And it's been therapeutic for me. Of course, we're going to be anxious. And I think, one thing, what I do sometimes is, hate to be an armchair psychologist, but I have a brother-in-law who last year had a terrible stroke. He was in the hospital in therapy for 6 months. I asked him, he said, of course, would you rather battle COVID-19 or your stroke? He said, that's not even a question. I think about the people who are getting a stage 4 cancer diagnosis, or the 650,000 Americans who die from heart disease. We're fearful, but in the end, this will pass, and our skills are really relevant. And I guess if we had a federal government that was functional, that, and it's not a one-party thing. The whole thing is polarized and it's political. The states, we're seeing this in real time. Your efforts, the efforts of states and localities, and we're seeing people say, whether it's Governor Cuomo or Governor Newsom, and we can go down to Governor Whitmer. Look at this. Right. They're the mobilizers. The next phase is going to be people saying, look at the people on the reopening front lines. Look at the local efforts, the cities, the communities, the governors who are now taking the lead in a reopening effort. That's where we come in. And we can lead that for our towns. And our skills in economic development, workforce development, community development, transport, transit, destination are so valuable. So I think, we have to all throw in, and we have to hasten recovery. Tracy, just like you said, Lord God, I've been a professor for 30 years. I am incompetent at educating. I am just seeing the skills I don't have. So yes, we got to, that we really have to help this reopening effort so that moms and dads can, get back to doing what they're doing, and kids can get back to school. And that our preparedness now will open the path. What we do now will open the path for us to be able to do that in the future.
This is Stephen. This is Stephen. One of the things I'd add to that is sort of, as an economic developer, I think one of the things that we have to be charged with as well is communicating to our elected officials, our stakeholders, our businesses, and community residents about the importance of economic development in a time like this. I think we all are aware that as you look sort of out to the future, there's some thoughts on, will there be budget cuts? Will there be downsizing, those types of things as we look at city government budgets? But I think one of the things that is really, really important, to Richard's point, is that this is a time to double down. This is a time to really invest in economic development. This is time to invest in our communities, not only in the recovery, but also as sort of the last point that Rich made, as you look at the 3 phases, and that's really thinking about resiliency and sort of how we think about this, and what the lessons are learned for how we push this forward on a go forward basis, that if this does to happen again, how our communities can recover from this in the future, I think.
Right. Here's a question for both of you. We talked in the presentation about some lifestyle changes, but what are some of the lifestyle and industry trends that should economic developers anticipate in the next 6 to 12 months?
This is Rich. I'll start and then let Stephen in. I think we don't fully know. And I think it depends on how long this goes on. If we can get past it in 6 months, I think there'll be fewer. If it goes on for 24 months, I think they'll be bigger. I mean, I think the big ones would be fear. The fear ones are the ones that crop up to me. Fear of airport, fear of train and transit, fear of public amenity. So those are the things I would put up as the biggest red flags. And then, when you say industry trends, I think we can look at certain industry trends, obviously hospitality, tourism, certain sectors. But I think taking a deep look, and as Stephen said, this is where our toolkit comes in. Taking a real look, clear-eyed look at our own data, our local data on our clusters and our industries. Which ones seem to be holding their own? Which ones may be growing? Logistics, warehousing, delivery. Which ones may be getting hurt? I think we need to take a very local deep dive now into that. Stephen, I'm sure you have something else to add.
Yeah, I think when I think about the export clusters, I think one of the things that I know that I've already been chatting with folks about is looking at supply chains. I think that we'll start to see maybe some changes in domestic supply chains. And so what opportunities does that create for particular sectors in your local communities? I think that's one. I mean, I think the other piece of this is, as we think about, the recovery, we have focused a lot on small businesses, and partly because those are sort of the front porches to our communities. But one of the things that I would encourage us to do is Rich has said, is really assess those sectors, your export and traded sectors, understand what their challenges are, what their challenges are, but also what potentially some of the growth opportunities are. And I think some of those growth opportunities will be in that supply chain development. And that's where I think that public-private piece becomes really important in terms of economic development.
Yeah, and 2 other things. One, I think the oil and gas economies are really getting killed. So take a look at your vulnerability there if that's part of your economic mix. And 2, and I said this before, look at your potential for remote work, because I think remote work is not just a trendy thing. What's interesting to me about remote work is it reduces the vulnerability of your local labor market, because the remote workers are by definition attached to other labor markets. So I'm not saying it's a panacea or a be-all and end-all, but looking at your vulnerabilities and then looking at certain things that you can use to supplement your labor market is useful.
Yeah, agreed.
So you both mentioned our economic development toolkits. Will those tools still be relevant to us through this pandemic? We're so used to incentives being part of the mix. We're so used to how do we train and develop a workforce. How are those going to apply when this is over?
I think incentives are going to be less useful. And the reason I think that are 2. One, I think that state and local budgets are going to be hit hard. So to what degree will states really be willing to put in place large incentive funds? 2, if I'm looking at what the governors are doing now, for the first time because of federal inaction, they're setting up a consortia to work together. If that consortia sticks, one can imagine the governors in a fiscally strained environment saying, oh, you know what? One way to protect our revenues is to stop giving money away. So I think incentives will be more limited. And who knows, maybe there'll be federal policy to limit them as well. I think the workforce tools and the economic development industry cluster tools will become ever more valuable. And I think this idea of building a more resilient, whatever you want to call it, vibrant, functional local economy, that part of the toolkit, which we have, I mean, the federal policymakers have done nothing on that. It's really local economic developers, city and state, if you will, metro, regional, and city and state that have developed that toolkit that's powered a lot of our recovery. You know, I think that's a lot of the reasons that we had the recovery we had. And finally, I think because so much of our recovery from the virus will have been inspired by state and local, people will turn a better eye to that. So I'd say more money will go to that kind of recovery, industry cluster building, industry building, small business development and workforce than to incentives.
Yeah, I concur. I mean, I think that one of the things that I'd also point out about incentives is that I think that there will not be the community appetite for the support of those. We already were sort of seeing that play out sort of in the media before this. But I think that as we go through this recovery, I think our community members, our city council members, our elected officials, those types of folks will be looking for us to make investments into local community entities. So I think that will play an important role. I think about workforce development. I do think that this is a really interesting time to think about really innovative, quick programs. And so thinking more about, you know, short training programs, on-ramp programs, developing partnerships with industry professionals that are tailored specifically for your communities, you know, rolling out things that you may had not had the opportunity to do beforehand. This may present you with an opportunity to test some new ideas and get those go to market a little bit faster with some of these ideas.
Great. So in the coming months, how can economic developers balance the need to build or rebuild their local business sectors and concentrate on exported products that may provide livable jobs?
So this is Stephen. I think you have to, I mean, the answer from I would be that you have to do both. You know, one could argue that one of the reasons after the 2008 and 2009 crisis that's really made this pandemic or this economic shock really hurt is because we really swung really far on the local business sector development. And so I think this recovery, from my perspective, is possibly going to be led by us ensuring that our export sectors are growing and the supply chains are growing there, and seeing some of the local businesses follow that. So I think that you have to do both. I don't think you can go all in on one or the other. That's just my thought.
I agree with Stephen. You know, if you break the economy into traded sectors and local sectors, obviously the traded sectors are the drivers. And in fact, when we combined Mike Porter's analysis with ours, we found if you have traded and high human capital or high knowledge professional creative occupations, they're huge drivers. But localized is really important too, because we've got to secure that. We've got to make sure it's safe and sound and doesn't evaporate. So as Stephen said, both tracks, and really we are the people, economic developers. It's not mayors. We are the folks who are really thinking about that. So this two-stage recovery plan, working on both tracks, traded and local, industry and skill or occupation, I think is where we become extraordinarily valuable.
So we know that this virus is really unmasking deep economic disparities in our communities. You mentioned that in the presentation. How do we view the effects of COVID-19 on communities of color? And will the pandemic further disadvantage communities of color? And then the third part of that is, what is the role of EDOs and anchor institutions in supporting these high-risk populations?
So this is a really great question, and it's exactly what Stephen and I were working on. Before we turn to this, our last three projects, were a project with Newark, which is being transitioned into this, a project with Philadelphia and the anchor institutions, led by Drexel, University Science Center, and Jefferson Medical Center, and a project in Denver for Mayor Hancock on exactly this. How do we move the dial of the economic development toolkit and of anchors, right? It was exactly the project. How do we incentivize, encourage anchors to get more involved in mitigating. They've created economic revival, but they haven't, through no fault of anyone's, but just that we've powered an urban revival, but that revival has been uneven, and the revival has not benefited communities of color, traditionally disadvantaged and minority communities, people, residents and their neighborhoods, and economically disadvantaged people. So it's what we were working on. And now what we're finding, although the data aren't completely in, but the data we have, is that this virus is falling so heavily on communities of color. Charles Blow in the New York Times just had an opinion editorial today about this. And these communities are starting to mobilize. You know, you could see coming in our community, on the one hand, our frontline workers who are disproportionately women, disproportionately people of color, ethnic minorities, and immigrants. You already can see a new class, the labor mobilization there happening. These people are saying we need more money and we need better PPE, and the companies we work for are raking it in. The second thing you can see is communities beginning to say we need more help here too. And look, you have the privilege to work remotely. Someone wrote today, remote work is a privilege. You have the privilege to stay at home and get deliveries. We don't. So yes, I think a mission of economic development today becomes cutting across this divide. And, you know, it's been a divide between economic and community development, but we have to heal it. And I think we have to lead it. And secondly, I think this idea of anchor institutions is incredible. Anchor institutions have been hesitant. They don't want to have a social mission. I can understand why university presidents and that, you know, I understand this. But now we have no choice. We're all in on this one. And anchor institutions, I think, can be convinced with your support, with the support of economic and community development, local leadership. I think anchor institutions feel it and can be brought to the charge to support this. Stephen, I'm sure there's other things you have to say here too.
No, I think you hit it. I mean, the other thing I would just say is, as we're talking about the definition of an anchor institution, I mean, one of the things that our work in Newark has been really about is about broadening the definition of anchor institution. So, you know, if you're thinking about if you're a small town, a small community, and maybe you don't have a university system, and all you have is you have just a healthcare institution, or you've got a robust nonprofit sector, sort of thinking about how some of these long-term players in Newark, for instance, so a lot of the work that we've been doing, as you know, Rich, has been around helping the community development corporations, the CDCs, be seen as anchors and play a real role, because frankly, they're on the front lines of helping communities that have been disadvantaged in the past have a voice in economic development. So I think it's about, you know, it is about engaging anchors, but it's also, as we as economic developers also have to think about how we potentially broaden that definition, which are those sort of community anchors in our communities.
Let's see, I have a question on, do you see a shift away from urbanization in the coming years? And this is to both of you.
Not overall. So this is a very nuanced answer. I think that when we look at the metropolitan level, this is, I mean, I've looked at this, the history of this. If you look at the top 10 metros in 1910, the top 10 metros in 1920, after the 1918 pandemic, and the top 10 metros in 1930, the list doesn't change very much. What's really interesting is New York maintains real dominance. It gains millions of people. Chicago stays in number 2. Detroit, which was hard hit because of its manufacturing, zooms up the list, becomes, you know, it's kind of outside the top 10 in 1910, zooms up into the top 5 by 1930 because of its economic propulsion. St. Louis, which is always heralded as the place that addressed 1918 the best, goes down. Where Philadelphia, which was devastated by the pandemic, stays number 3. The only other place that really comes into the picture is LA. And by the way, I think LA is we could talk about that. I think LA is a very interesting case now, because if people want backyards in a big city and they want to drive a car, LA, and it has a lot of congestion already, it may have some advantages. I think what changes is the microgeography. I think that there will be people, particularly people with families, who are again, so if I was an economic developer with a big central core city that was experiencing revival, I'd want to address this. I think that there are going to be families who are coming back to the city who are going to get scared. They're already scared. They're already moving to the second home, the country home. They're renting homes. I think there are remote work. If I was a smaller metro, I'd probably be doing less to try to attract industry and more to attract remote workers because they're going to be looking for places to go. So I think there are opportunities all across the board. It's hard to say, but I don't think it's going to staunch the flow of urbanization. I think we're going to still be urbanized, but within a metro, who wants to be in the central core? Who wants to be in the transit-oriented close-in suburb? Who wants to be in an exurban rural area? That's going to change. And for smaller metros, there will be some opportunities. There will definitely be some opportunities. So that's the picture I would paint.
Yeah, I agree with that.
So we're about to get in a few of the questions from the audience, and one that popped up that I'll share is, can the speakers also share some thinking about how COVID will prompt a rise in social benefit corporations?
Stephen, I'll hand that to you.
I knew you would. Yeah, I mean, I think that there will be this need for us to think about how we are addressing some community issues, as well as sort of thinking about how we can do that in a way that gets scale. So yeah, I do think that we'll see the rise of those organizations. I think the real question will be, just as with other types of organizations, how do we help those organizations get the technical support, the scale to think about growth in terms of mission, in terms of purpose?
Yes, I think they'll benefit, but I think there'll be other interesting trends. One of the things that has faced our communities has been a tech backlash against Google, a backlash in where I live part of the year, Sidewalk Labs in Toronto, a backlash against Facebook. I think we're going to learn that we need some of this data, and that tracking digital thermometers and the data on people's mobility, where they're going and spreading. I think people are going to say, yeah, my privacy is invaded, but if my kids are safe and my mother-in-law is safe, my family's safe, they track my cell phone. And so I think this is going to cut in all sorts of directions. At the same time that corporations, social benefit corporations, socially responsible corporations will benefit, I think that we're going to, and I think herein, this idea of privacy, that's an area where economic developers could also help a lot. How do we govern and how do we set up better governance organizations? And we're going to, because the city governments can't do this right, we're going to have to do this. How does the economic development community at the local and state level really think long and hard about the appropriate governance over data privacy, which is just going to become so much more important as we get through this crisis?
It's a great point.
Yeah, totally. What are your recommendations? And we've talked about this briefly, but we have questions about recommendations that you may have for rural communities.
I'll take this one.
Well, yeah, go ahead, Stephen, and then I'll fill in. Sorry. No, you go.
Yeah. No, this is a great question. It's actually one that I've been thinking a lot at, partly because of some of the work that we're actually doing at the University of Texas at the LBJ School, but also with IC Squared, which is a organizational campus that has for a long time thought about sponsoring innovation and entrepreneurship in urban communities. And the shift at UT Austin is now we have shifted that to really focus on rural communities. So a group of us have been exchanging ideas. I think one of the things that for rural communities particularly, which will be a real sort of opportunity, is that if you think about our metropolitan areas and our urban areas, we for a long time have really been pushing this idea of regionalism, this idea that we come together to formulate regional strategies and regional plans. Rural communities have been sort of slow to do that. And so this, from our perspective, I think this is one of the opportunity now that we're sort of thinking about this recovery, thinking about limited resources, thinking about how we can scale, the opportunity for rural communities to sort of see themselves in terms of regional cooperation. I think that will be really, really key and really, really central. So the first idea is sort of thinking about how we work together. The second idea, I think, for us is that, if you think about how we have focused, a lot of the growth around rural communities has been through tourism, local business development, retail, those types of things. I think just as cities have had to think really hard, and urban areas, metropolitan areas, have had to think really hard about their export economies, the same now probably has to happen for rural communities. I think we're going to see that a lot of these places, because of the lack of tourism, hospitality, those types of things, could potentially be getting needing to think about what are the export, what is that one or two sectors that can really drive their own local economy in terms of going forward. I think there's the third point is, in many of our rural communities, there is an unengaged anchor institutions. Urban anchor institutions have been really engaged, have been at the forefront of engagement, opportunity for rural anchor institutions to think about engagement. And then finally, I think, is that if you want to do the things that Richard has suggested, and that we sort of outlined in this deck, and that's focused on remote work and the promotion of quality of place and the idea of assets and connecting to the urban core, I think one of the things we all know is that we'll have to address some of the infrastructure issues. So, I think it is about thinking about how we cooperate better, how we ensure that we've got the digital infrastructure to promote that remote work, and then finally thinking about, what are those sectors that can grow outside of tourism and hospitality for sure.
So two more things to just build on what Stephen said. One is rural areas are being hit hard by the virus, and we can't forget that. In the analysis done by Bill Bishop, the great reporter formerly of the Austin American Statesman, who wrote the brilliant book, The Big Sort, who now has a website called The Daily Yonder. Rural recreation counties, those Colorado counties, those counties in Idaho, the areas of New York that are rural but they're jet set, if you will, jet set counties, have a lot of travelers to ski resorts or to recreational places. They are being hit so darn hard by this virus. The second thing is, I do think there's already been a trend for rural gentrification. That has already been happening. And the way I would always say this before the crisis, I'm making fun of myself, folks, with air quotes. American creatives have always been drawn to cities, but anyone who studied American creatives, from Jackson Pollock to Bob Dylan, knows they also had, the hippies were going to the California rural areas. They were going to Woodstock for the concert, and the reason they had Woodstock is they actually asked the guy, Michael Lang, to open a studio there because there were so many musicians like Dylan and others who had moved up there. And then he said, well, I'm not just going to have a studio. So many people up here, I'm going to have a concert. So rural gentrification is part of us. I think that's going to be an area. And I think that's going to have some fights. The town gown, the local newcomer fight is going to happen. And we need to be prepared. And then all the things Stephen said, diversifying those economies, engaging anchors, making sure they have economic rationale other than just tourism and, gentrification. All those things are important. But I think rural areas with strategy and intent, rural areas could benefit a lot from this.
Agreed.
I think this question will kind of tie into the discussion about rural communities, but this has to deal with our food industry. What is the protection of food security? And should we expect food shortages going into the summer and fall due to farms needing to comply with social distancing, or even the need to have PPE equipment?
I'll say I don't know. And then I'm sure Stephen has thought a lot about food security and food chains and worked with people at ICI and elsewhere. I don't know. I don't think so. I mean, I understand some of the issues with undocumented workers and immigrants and PPE, but I think we may have some shortages of some items, just like we're having shortages of some items now. But look, our food system and our food delivery system is so much better than just about any place in the world. I think we'll be able to manage this adequately. But maybe, Stephen, you have a different take on this. You've studied it more than I have.
No, I think you're right. I mean, I don't suspect that we'll see any issues. I think the one question would be some gaps in supply chains. But other than that, I think for the most part, I think this is I don't see this as an issue, frankly.
There may be some changes, right? Instead of going to the restaurant, the supply getting diverted to households. So there may be some things we can do, to just like fancy restaurants are going on delivery now. I was amazed the other night when I saw all the fancy schmancy restaurants that I've never seen on like an Uber Eats like platform or Postmates or whatever one you use. All the fancy schmancies were on there. So there may be some things analogous to that where we get a farm to fork delivery of produce, and we start to build up those supply chains so it doesn't go through. I have no problem with grocery stores and other things, but maybe there's ways to aggregate locally and provide more farm to fork that used to go maybe through restaurants or through a market. You're not going to go to that warehouse market and pick your produce anymore and pick your fish or meat, but there might be ways to do that, that economic developers and others that can link farm to city side, and be healthier and better for us and support local economies.
Thank you. This question is, do you believe this is the opportune time to focus on FDI, foreign direct investment, and shore up our target industries with suppliers and service suppliers that are located close to their customers?
I never thought about this, but this is a really good idea. So right now, the idea coming from some of the more nationalistic elements of our politics is move the stuff back and Americanize it, right? Bring everything back home. But what we learned, and this is when I became an economic developer, for those of you who are my age, you'll remember this. My first speeches to you were about Japanese investment in the heartland. I was teaching at Ohio State. I was studying it and saying, no, this could be a good thing for America. Having Toyota and these other great companies in our backyard and their suppliers. And what happened was, because we got proactive and we liked quality and we developed manufacturing extension, we developed one of the great manufacturing bases, but was multinational. German companies, Japanese companies. My brother-in-law in Detroit, he works for a big German auto supplier. This idea of internationalizing our supply chains by saying, no, it might not make sense to have everything offshore. But instead of saying we're going to cut you off, come to the United States and help us build some redundancy or some capacity, build up our industrial clusters, get away from this bashing of other societies, right? I like this idea. And I think it's one that bears some more, we'll put our thinking caps on, but this idea of thinking globally and locally, I hate it, global and local together, and encouraging all of these great companies from around the world that are already in our community, saying, why don't you reach back if you're a German company, if you're a Japanese company, if you're a Chinese company, bring some of and you know what? The old wage arbitrage that was going on, the wages have grown in some of those countries. So come to the States, help us build up redundancy and capacity, and build out some more resilient supply chains here. I love this idea.
Yeah, well described, Richard. I absolutely think it's a great idea. In fact, again, I think thinking about supply chains and the levers that you can pull with supply chains is a real opportunity for growth, particularly some of the export clusters. Absolutely.
All right, so this question has to do with unemployment benefits. And the question is, in regards to the recovery and next steps, what are your thoughts on the $600 increase to unemployment benefits? There are many openings that are not going to be able to compete with the total wages received between state and the federal increase. Your thoughts?
This was a topic on the daily Times today, actually. Same question was proposed. I think the take on this, right, is a lot of folks started to take from the reason that if you look at the benefit was one of the things that we're trying to do with the benefit is actually for many of these folks is to incentivize that they stay home, right? This idea of social distancing, particularly in some communities. And so, as you look at the people that are particularly some of the most vulnerable, those that have been in the retail and industry sectors that have been laid off, I actually am heartened to see that we've done more for these workers in a way to try to provide some bit of a quote, and I'm using big air quotes when I say this, safety net for them. So I think this is, from my perspective, a good thing.
Yeah, and I think it cuts both ways. You don't want a benefit in place forever that encourages people to not work. So for sure, but in the near term, you not only have to have unemployment to take care of workers, you need a good unemployment to reset the economy. The idea of pausing this thing for 6 to 8 weeks and getting people off the restaurants books, the small businesses books. How are you going to get them off the books? the only way they're going to survive is these functions come off the books, and maybe you need them in Canada. I don't know if this is the case in your communities. They sent us, our bank sent us a note right away and said, you can have a 6-month mortgage moratorium. We're gonna have to do that stuff too. And that will make people lazier. It'll just give them time. But I think we need to then, as local economic developers, say, what is the reemployment strategy we need to put in place to get these folks back to work? Some of it's a pause and a reset. Some of it is plans to reemploy your people as you reopen, as part of your reopening strategy. But no, none of us wants a bunch of workers sitting on the sideline, collecting a check. We all want to provide the assistance we need now and to get people back to work. The other thing is, maybe there are stuff we can do right now to put people to work. I was thinking about like just in our communities now, having people, like, instead of shutting down the parks, maybe some people can be monitoring the parks safely and securely. There are probably things we can do in retrofitting our airports, retrofitting our big civic assets, retrofitting our infrastructure, where we can bring some of these people into kind of a works progress, New Deal thing, but not for the New Deal, to really retrofit for this intermediate period. So we can give people money, but there's probably ways to give them work. And people would like that too.
Yeah, the other thing to keep in mind by the extended benefits is that it is for a short-term period. It is only for 4 months, right, as of now. So there is an end stop to this for sure.
I'll do a couple more questions. This one has to do with our anchor institutions, which many of us have in our communities, which are our public and private colleges. So what happens to our second and our third tier private colleges and universities in light of students now engaging in online education during the pandemic and potentially making these institutions at risk?
So let me start, and let me say I think they're all at risk. Maybe the super well-endowed ones aren't, but I don't know who's going to spend 50, 60, 70 grand on tuition for their kid to stay home and do online classes. So, Stanford has already announced that its top administrators are taking a 20% cut, that there's a hiring freeze and a salary freeze. That's Stanford, probably the second most well-endowed university in the country. The higher ed sector is going to get walloped. And I think you're right. The question is, the elite universities will be less walloped. I mean, think about foreign students. How are foreign students even going to get back to class? How are these dormitories going to reopen? So right now, we're going to have to engage our anchor institutions and our higher ed sector in a real, honest, so-called come to Jesus conversation about how they are going to retrofit to reopen safely and how they're going to put their costs in line. This is going to be a biggie. And I wouldn't say just higher ed. If you're in a New England community, I'm just thinking of these communities that have a lot of private prep and boarding schools, because some of these principals have been already reaching out to me. How do they survive? So this will hit parts of how will private schools survive where mom and dad is forking over a lot of money and there's no classes come fall? So I think the education sector, generally, I would say most higher education and mostly the less advantaged parts of higher education, but the education sector as an anchor, if you will, is in need of a retrofit and a rethink. And that's why we're saying from an economic development point of view, it's important for economic developers to help structure and drive that conversation, because the higher ed sector may not do that on their own. Maybe we did in the past, we thought about merging, acquisitions. Carnegie Mellon, where I taught for 20 years, was an amalgamation of Carnegie Institute of Technology, the Mellon Institute, and Margaret Morrison Carnegie College, which was the women's college, done during the Depression. So we got to have a close look at this today, for sure.
Yeah.
All right, so I will start wrapping up, and this will be my last question from the audience. What will the impact on the real estate market be in the next 6 to 12 months? I'm really listening to this too. This is good.
big. I mean, this is why, Stephen was at the Shack Institute until he recently moved home to Austin, Texas, where he's running this great project at the LBJ school. And the reason I took a visiting distinguished fellowship at the Shack Institute was to learn more about real estate. The real estate industry is going to take a whack. And, what are the segments most exposed? Commercial. Think of the whack to the commercial real estate industry is going to be horrible. I mean, office buildings, co-working spaces, we can go on. The hotel industry. And, maybe the big 5-star chains, but how about those class Bs and Cs? There's an opportunity, by the way, I think I mentioned this, in those for workforce and affordable housing. We should be thinking right now about how to start to think it from an economic development and urban development point of view, how to reposition those. Retail. And not just urban retail and urban commercial. Malls, office parks. I mean, it's going to be really problematic. I think multifamily is going to have to do a rethink because I think people are going to be scared, maybe not of their unit, but they're going to be scared of common areas and these places that have been marketed in urban center after urban center as a shared pool, a shared gymnasium, a shared this, a shared screening room. Those things which all look so attractive are not going to be so. I think that there are parts of the single family home market that will boom and parts that will be hurt. I already mentioned, I think so many of these desirable close-in suburbs served by train and transit that had such a premium. Now they're going to be fine because they're beautiful places, but that some of that premium maybe go away. I think that some rural areas are going to be more hotly desired. So yeah, I think each community in each region should be doing a real close think and working with the real estate professionals to think about how this damn thing is going to damage the real estate industry and where there may be some opportunities for conversions and retrofits.
Hey, Rich, this is Stephen. You had some great thoughts on maybe even how not just the real estate, but also land use code was going to be impacted. Share a little bit about that. I think that's worthwhile.
Well, I think that every pandemic typically registers itself in. Look, I think what pandemics do, we have the why urbanization occurs is the gains to productivity. When people cluster in urban areas, metro areas, cities and suburbs, and form a sizable economic unit, a market. The thing that acts against that are the diseconomies. The one that we've talked about a lot in theory, urban theory, has been traffic congestion. The one that we forgot is the big diseconomy is damn health risk. If you look at what has spread our population in the past and what has caused real changes in city building codes and city zoning and land use, it's been threats to our health. And that's what we really see change in the way of pandemics, like the 1918 pandemic. So yeah, I think you could start to see zoning codes and building codes that change, that require more open space, that require less density. I think NIMBYs, there's been a big YIMBY movement. I've been kind of a part of that, a reasonable supporter of that. Yes, in my backyard. I think this is going to empower NIMBYs. NIMBYs are going to say, I don't want any more density. Density's bad. I'm scared of it. My kids, So yeah, I think it could really register itself in land use and building codes. And here's where, again, economic developers can have a role to play by saying some of this stuff is necessary in health and for safety. Other of us will impede our economic progress and is not so necessary. So being very, and, partnering with our real estate friends, groups here like the Urban Land Institute and others who think about this, more, and other real estate groups. I think, and then finally, the use of technology in real estate. I think one of the areas that we're going to see a big surge, and I've said this, I think that not just prop tech and real estate tech, but the use of technology to manage real estate, the use of technology to make ourselves safer in our homes and condominiums and apartments and multifamily. All of that stuff's going to be more important. So partnering with some of these urban tech firms, not just the real estate firms, to learn more about that could be something that's very important for us going forward.
Yep, it's great.
Well, my last question, and this comes from someone on the TIP strategies teams, Jacqueline. And her question is, and I really connected with this, are there silver linings to this? For example, reduce pollution and consumption because of the sheltering in place. If there are some positive aspects to this, do they think that, or do you guys think that people may adopt more climate-friendly behavior after COVID-19, or will they typically default back to old behaviors?
That's a great question.
Well, this is Rich. So, yes, I think there's a silver lining. I think there's a big silver lining. But what followed the 1918 pandemic? Was it a new civic mindedness? Was it a new social mindedness? Was it a country coming to grips with its problems of inequality? What followed the 1918 pandemic was the Roaring 20s. It took another 20 years, a depression and a world war before we woke up and came to our senses. So I wouldn't say that this scare alone is enough to jar us out of the over-consuming, hyper-materialist, hyper-individualistic, all the things that we've come to see in our society when we hold it up to a mirror. That said, it could be. It could be. All the things you said, people are consuming less. They are spending more time with family and friends. They are reaching out to one another. There is a new civic mindedness, and maybe we can help lead this. Maybe we can help become beacons in our communities of this. Where I think you're right. We've seen already some argue. Now, I'm not making this argument. Some argue that although Wuhan and China were so hard hit with deaths, that the reduction in pollution actually will end up balancing, maybe not compensating, but the number of people who didn't die from exposure to pollutants and the horror of the Chinese environment, is important. We're seeing less of that. We're seeing less of this consumption and shallowness. Here's what I think the silver lining is, though. If we work together, if we stay with our social distancing, and people are impugning America, I think this is nonsense. Yes, we didn't get off our ass quick enough. Yes, we made mistakes, but we're mobilizing our states and localities. We're creating that surge capacity. We're going to develop the antivirals and the therapies, the vaccines. We're going to make them. We may look back at this in 2 or 3 years and say, we had a public health miracle. It's hard to see that now, and if we don't stay vigilant, we don't mobilize, but we could say, this could have been the Spanish flu, but look what we did, even with all the bungling in the beginning. So I think the great silver lining will likely be that although this was tragic, and although we lost people, and many of us will lose family and friends, that we saved an utter catastrophe, that we intervened in ways locally, and I think up from the bottom, the way we always do in America, up from the bottom, from states and localities, doing things, coordinating, working hard, flat out. That's the silver lining. We could look back at this in a few years and say, we really did better than anyone thought we could. And I do think there's light. I watched the Queen. I never watched the Queen before in my life, but, I thought she was great, folks. And I thought she was great. And, the fact that her and her sister in 1940 had to give that speech, there will be a light at the end of this damn tunnel, but we all got to work, and all of us got to work together to get there.
Yes.
Great.
Well, I really love this. I enjoy that both of you guys were on this call, and I want to thank you for joining and sharing your insights. Rich, I look forward to seeing you January 24th through the 26th at Leadership Summit in Phoenix. And thank you all for participating. Please continue to check out the IEDC's website, restoreyoureconomy.org, to find resources and tools. Please be safe and well and healthy. Thank you all for attending.
Thanks, everyone.
Thanks so much.
Bye, guys.